The purpose of the video is to help educate healthcare professionals on how to prepare and administer Phesgo. For full information on dosing considerations, dose modifications and monitoring, and complete administration information, please review the Phesgo full prescribing information. Phesgo is a fixed-dose combination of pertuzumab and trastuzumab in a single vial for subcutaneous injection. Phesgo is indicated for HER2-positive early and metastatic breast cancer. Its short administration time, 5 to 8 minutes compared to hours with Perjeta and Herceptin IV, may reduce the burden on patients, carers and providers. It also relieves the strain on infusion centres and allows greater patient access. Let's start with the product itself. What is Phesgo? Phesgo is a fixed-dose combination, which means that all patients receive the same dose regardless of their weight. Phesgo comes in 2 formulations. The first formulation is a loading dose, 15 ml of solution in a 20 ml vial. This ready-to-use vial contains 1200 mg of pertuzumab and 600 mg of trastuzumab and is used for a patient's first injection. The second formulation is a maintenance dose, 10 ml of solution in a 15 ml vial. This ready-to-use vial contains 600 mg of pertuzumab and 600 mg of trastuzumab and is used for all subsequent injections. Store Phesgo vials in the refrigerator at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit in the original carton to protect from light until time of use. Do not freeze or shake the vials. How to best prepare the patient for Phesgo injection. There are a couple of points that can help a patient to prepare for the injection. Consider asking the patient to wear loose clothing that would make it easy to access the thigh area. A skirt or shorts may be an option. Set the expectations around the overall timing. The injection and observation period for the initial loading dose can take up to 38 minutes, 8 minutes for the injection and 30 minutes for observation. Subsequent maintenance doses will take considerably less time. Phesgo injection. Time to prepare the solution for the injection. Please follow your local or institutional guidelines for preparation. When preparing for administering Phesgo, use the personal protective equipment according to your local facility standards. To prevent medication errors, it is important to check the vial labels to ensure the drug being prepared and administered is Phesgo. Select the right dose and check the expiration date. Inspect the vial for particulate matter and discoloration whenever solution and container permit. Phesgo is clear to opalescent and colourless to slightly brownish. Do not use if particulates or discoloration are present. The initial and maintenance doses are ready to use for subcutaneous injection and should not be diluted. Start by attaching a transfer needle to the syringe. Remove and discard the vial cap and wipe the vial stopper with an alcohol swab. Allow the stopper to dry naturally. And then, holding the syringe by the barrel, insert the transfer needle to the center of the vial at a 90-degree angle. Now invert the vial and slowly pull back the plunger until you've withdrawn the contents of the vial. A slight vacuum will be formed in the vial, so ensure that the plunger does not get pulled back into the barrel. Also, be careful to avoid completely removing the plunger from the barrel. Discard any unused portion remaining in the vial. Once the contents are withdrawn from the vial, remove the needle from the vial, then remove the transfer needle from the syringe. Apply a patient information sticker to the syringe. If the solution will not be injected right away, replace the transfer needle with a syringe closing cap. Do not attach a hypodermic needle until the time of administration to avoid needle clogging. After filling the syringe, Phesgo can be stored in the refrigerator for up to 24 hours. The solution should be administered at room temperature, so remove it from the fridge enough time in advance for it to warm up. At the time of administration, detach the transfer needle or syringe stopper and discard, replacing it with a sterile injection needle. The suitable injection needle for this solution is between 25 and 27 gauge and between 3/8 of an inch and 5/8 of an inch long. Phesgo is now ready for injection. How to administer the injection of Phesgo. Phesgo should always be administered by a healthcare professional. Ask the patient to sit back in a reclining chair or bed and to make the thigh area accessible. Be sure to arrange your chair at the right level so that your feet are flat on the floor and you are able to sit up straight without twisting, bending or reaching to administer the injection. You will be in this position for approximately 5 to 8 minutes, so be sure you are comfortable and in a position that you can maintain. The injection site should be alternated between the left and right thigh only. It is never administered in the abdomen, because this may lead to a lower concentration of Phesgo in the blood. Do not split the dose between 2 syringes or between 2 sites of administration. Each new injection should be given at least 1 inch or 2.5 centimeters from the previous site. Choose an area of healthy skin that is not red, bruised, tattooed, tender or hard. During treatment with Phesgo, other subcutaneous medications should preferably be injected at different sites. To perform the injection, pinch the skin of the thigh with one hand to create a fold. This makes it easier to get the injection into the subcutaneous tissue and not into the muscle tissue. Inject and maintain the needle at an angle of about 30 degrees. Note that the injection can be somewhat stiff and tough at the start. The dose should be administered at a rate of no more than 2 milliliters per minute, so you can expect the loading dose to take approximately 8 minutes to administer, while the maintenance doses will take approximately 5 minutes. Most patients have a positive response to the process. If at any point during the injection a patient feels pain or discomfort, ease off the injection before continuing. Keep the needle in place and check to make sure that the needle is at the right 30-degree angle of injection. The injection should be slowed or paused if the patient experiences a significant injection-related reaction. The injection should be discontinued immediately if the patient experiences a serious hypersensitivity reaction, for example anaphylaxis. The administration time presents a good opportunity to talk with the patient, to get an overall sense of their well-being, and to discuss any concerns they may be having. Once the full dose has been administered, wait briefly before removing the needle to minimize any potential leakback. After the loading dose, the patient should be observed for a minimum of 30 minutes for signs of hypersensitivity symptoms or administration-related reactions. After the maintenance doses, the patient should be observed for a minimum of 15 minutes. Make sure that medication to treat reactions, as well as emergency equipment, is available for immediate use. For full information on dosing considerations, dose modifications and monitoring, and complete administration information, please review the Phesgo full prescribing information. By preparing yourself and the patient for the subcutaneous injection process, you can anticipate a smooth experience with Phesgo. Thank you for taking the time to watch this video and for all the work that you do for patients.
The desire to help people is at the core of every healthcare organization. At ICU Medical, we demonstrate this commitment by providing products and services that let clinicians focus more on their patients and less on the technology they use to care for them. We call it clinical excellence, and our Plum 360 infusion system provides a direct connection to help you achieve it. The unique design of the Plum 360 infusion system creates a direct connection for secondary infusions. This smart delivery method eliminates the risk of common secondary setup errors that have been shown to occur in 48% of secondary infusions. allowing secondary infusions to be delivered independent of head height, and helping to ensure that every milliliter of medication is administered and that infusion records are accurate. This direct connection even allows you to simultaneously deliver 2 compatible medications at independent rates through a single line, something no other pump on the market can do. As you begin to program your infusion on your Plum 360 with ICU Medical MedNet software, you're brought directly to the drug list, which helps to ensure that the limits set forth in the drug library are utilized, maximizing your hospital's investment in safety software and greatly improving drug library compliance throughout the facility. When it comes to air management, the Plum cassette can trap up to 1 milliliter of air before sounding an alarm, which results in fewer potential therapy interruptions. If the alarm is triggered during a primary delivery, air can be removed quickly and easily through a direct connection to the secondary administration port without disconnecting the line from the patient. This helps to limit exposure to hazardous medications, reduce the chance of contamination, and minimize wasted medication. And finally, when you and your electronic health records partner are ready, so is the Plum 360 with ICU Medical MedNet software. Our IV EHR interoperability solution automatically populates your Plum 360 infusion pumps with medication orders direct from the pharmacy and sends all infusion data directly to the patient's electronic health record, resulting in fewer opportunities for programming errors, more accurate and timely documentation, and more efficient workflow. Why invest in anything less? You get more than a smart pump in the Plum 360 infusion system. You get a direct connection to clinical excellence.
Managing your IV oncology workflow while cost-effectively balancing the need for safety and efficiency can be a challenge. But that's all about to change with ICU Medical's complete system of needle-free CSTDs, smart pumps, and safety software. Only ICU Medical lets you keep a closed system from beginning to end, helping you keep clinicians safe from hazardous drug exposure and comply with industry-safe handling recommendations. Here's how it works. Once the patient order is in the pharmacy, we help your team safely prepare the medication with our intuitive ChemoLock or lure-based ChemoClave CSTDs. When the drug product or prescription arrives at the nursing floor, we help you reduce infusion setup time with smart pump programming enabled by ICU Medical MedNet's IV EHR Complete Interoperability solution. With administration-ready sets featuring our pre-bonded CSTD components, you can avoid gathering and assembling additional parts and pieces. We make medication delivery more efficient with the Plum 360's unique air management, helping to reduce air-in-line alarms and giving you the ability to backprime air out of the line without breaking the line or disconnecting from the patient. And the complete IV EHR interoperability solution can also help you improve revenue capture by accurately documenting infusion data, even on secondary administrations. Enhance your current workflow. Don't change it. Only ICU Medical lets you maintain a closed system from beginning to end, from pharmacy to patient, helping you keep clinicians safe from hazardous drug exposure and comply with industry-safe handling recommendations. To learn more about how ICU Medical can help you enhance safety, improve efficiency, and maximize profitability, visit ICUmed.com.
When life is turned inside out, you double down on what you do best. When the world is on lockdown, you dig deep into the science to create critical diagnostic tests in the space of weeks, not years. When hospitals struggle to add intensive care units and thousands of beds, you find a way to provide the equipment and devices they need to care for patients. When supply chains are stretched to the breaking point, you go to the well. You call on your people and partnerships to get the essential technologies of diagnosis, treatment, and discovery to the labs, the hospitals, and the workers who are saving lives. And when questions exceed answers, you do all that you can to help researchers advance our understanding of of the immune response. And you do it all because you know the hazards and burdens people face, with older parents, younger children, and round-the-clock worries. It's why long before COVID-19, we helped wage battles against polio, tuberculosis, and HIV. It's why we're in this fight right now, and why long after, we will keep doing our part in support of human health. It's what we do. It's our entire reason for being.
Are you a Philippine-registered nurse? Introducing Nurse Accelerator. Joining this community is free. This is for nursing students, call center nurses, acute nurses, nurse managers, nurse executives.
It is a dedicated space for Filipino-registered nurses, aspiring nurses, and healthcare professionals. The Nurse Accelerator provides guidance by giving tips, knowledgeable advice, and educational information. Our goal is to help nurses and healthcare professionals accelerate their careers with proper support and encouragement. Here's a dedicated space for dedicated nurses like you. See how we can help you on your journey to success.